This is Jose Merino, Editor-in-Chief of the Neurology family of journals. The Neurology podcast provides practical information to neurologists and other clinicians to help them provide better care for their patients. Thanks for listening and have a great week.
Hi, this is Jeff Ratliff with the Neurology Podcast. Today I'm speaking with the recipient of the 2024 American Brain Foundation Ted Burns Humanism and Neurology Award. This year's winner of the award is Avindra Nath. This is not Avi's first time on the podcast, and listeners will remember his voice helping guide us through our understanding and knowledge of specifically the neurologic implications of COVID-19 throughout the pandemic. Avi's title is the Clinical Director of the National Institute of Neurological Disorders and Stroke, or the NINDS, at the NIH, and Chief of the Section of Infectious Diseases of the Nervous System at the NINDS. Avi's career is focused on the study and, importantly, improving the clinical care of patients with neuroinfectious diseases, more specifically in the study of neurovirology. The Ted Burns Humanism and Neurology Award is a peer-nominated award for members of the neurology profession who exhibit humanism through humble leadership, advocacy, innovation, and creativity. The award is named after Ted Burns, the founder of this podcast over 15 years ago, who passed away in June of 2022 after his long battle with cancer. As we've mentioned before, Ted was involved with the podcast throughout the entirety of his cancer battle, well after he stepped down as editor. And in listening to each episode, Ted would repeatedly text us or email us, reminding us how impressed he was and grateful he was for those podcasts that Avi was involved with. Ted would comment how incredibly busy and accomplished Avi was, but at the same time was willing to spend time with us here on the podcast, educating our listeners about what we are learning about the neurologic implications of COVID-19. And equally important, despite Avi's knowledge, he was still willing to be humble during our interviews and willing to admit what he did or we didn't know about some of the questions we were all trying to seek those answers in those scary times. His work has helped us better understand a number of neurobiologic diseases and syndromes, be it HIV, COVID-19, arboviruses, just to name some. And so while we'll touch on some of those, certainly this interview, we're going to touch more on Avi's career with regards to humanism and neurology. Avi, welcome. Congratulations on receiving this award.
Thank you, Jeff, for that very generous introduction. Truly humbled and honored to receive this award. I remember Ted with great fondness. I first got to know him through the podcast when our work on HIV led to the discovery of endogenous retroviruses and their role in ALS. Over the years, as you mentioned, he interviewed me several times, and I got to know him as a colleague and as a friend. He's certainly missed. The award of humanism in his name is truly fitting as to who he was as a person and as a physician.
Thank you. Yeah, and I think we both agree on that. Hopefully our listeners will remember a lot of those excellent interviews that the two of you did. Avi, there's a lot of different aspects of your career that we could touch on, but I think to start at the beginning, can you just tell us how was your interest in neurology and maybe even subsequently neurovirology first started?
So, we all have our childhood stories, as naive as they might be. And it started me the same way, with a fascination of the brain early in childhood. But that continued into establishing a career in clinical neurosciences. I think early on, I wasn't sure whether it should be neurology or psychiatry or neurosurgery, but through medical school, it became very clear really what I wanted to do was neurology. But then the interest in neurovirology emerged during my residency program. Those are the early 80s. The AIDS pandemic was just starting. And I was a first-year resident in Houston. And my first rotation was through MD Anderson Hospital. And so at that time, all these patients with AIDS were up in the bone marrow unit because only cancer doctors had seen these opportunistic infections that were occurring in these patients. So as a resident, you have to go and see all these patients, glove and gown, and go in there. And most of the attendings stand outside and just say, "Oh, okay, can you move your hands and feet?" And so I was seeing some very fascinating neurological complications. I got very interested in them. I wrote them up, and it got a fair bit of attention. So as a young person in your 20s and you're just starting off your career, I got quite fascinated by it. And that made me start looking for how viruses may do these things. And really my career moved in that direction from those early experiences.
And following that As you said, after residency, you went into fellowship training, both there at the University of Texas and then subsequently at the NIH, looking at neurovirology and infectious diseases. And you also alluded to the fact that this training was happening in the 1980s during the height of the AIDS and HIV pandemic. And I think many of us know about the stigma that was associated with patients with HIV and AIDS infection and the biased policies towards both the patients and the study of this disease. And so I'm wondering if you can talk a little bit about what it was like advocating for research, advocating for efforts to be devoted to HIV at that time, considering some of those attitudes surrounding HIV, and were you encountering barriers and roadblocks that were reflective of some of the stigma towards patients with HIV and AIDS?
It was a very different era and very difficult times that our country went through. The stigma really was to the patients themselves. Most of the patients at that time were highly educated white gay men. And what we all noticed was that access to healthcare was very difficult for them. Their families didn't want to have anything to do with them. And so when they died, they would be very quickly buried or cremated. And most families would say, oh, they died of cancer. But when I took care of them, they were, a number of them were physicians themselves, or they were very highly accomplished. So they told me a lot about life in general, what they faced as gay men. So I learned a lot from them, to tell you the truth. And their lifestyle, the issues that they faced in society, and what they would have liked to see. And then, as you know, over a period of time, the community became very vocal because there were so many people dying. There used to be an AIDS quilt that used to be put every year at the mall in Washington, D.C. And there at the mall, every year they would add more pieces to the quilt, showing that eventually the quilt became so big that the mall could no longer hold it. And then they were protesting. When I was a fellow here at NIH, I saw the act of people protesting. And so they come here, put up all kinds of effigies and saying that, science is killing them. Regulatory bodies don't really care. But they were very effective. They changed the way drugs are approved by the FDA. They changed the way we pay for drugs. AZT had come out, but it was very expensive. AZT was not good enough. And people needed access. So a lot of the ways in which we do treatment trials, drug approvals, was really initiated by them. And then the aspect of patients participating in design of clinical studies and conferences all came from them as well. So they, even to this day, patients can register for the International AIDS Society meeting. They all come there. They sit on various committees. All the AIDS clinical trials group has various clinical trial committees. And there's always community members there that sit on design of the study, analysis of the study, dissemination of the results. They participate in all those aspects. So they've had a huge impact. And I think some of those lessons that we've learned from them are ones that we should be applying today for various other types of studies that we do that involve patients.
I think it's important to those reflections both on the impact you felt from the individual patients, the conversations you'd have with them as individuals and their own experiences, but then again, the impact of the patients as a collective, right? The patients who are suffering and struggling with the disease, be it AIDS or diseases that patients are affected with today, and the impact they can have on us as physicians. I think sometimes, hopefully, is not getting lost, but we might be more aware of some of the impacts we might have on them as physicians, but it's certainly a reciprocal relationship. In looking at your CV and in preparing for the interview, one of the other things that struck me is the admirable effort that you take to highlight your own personal commitment to incorporating your value of diversity into your career as a mentor for scientists, for trainees, for those who are learning from you as a mentor. And I'm wondering if you can talk with us about those values and maybe more specifically, how has your value of diversity in medicine and in science and research influenced your career and your role as a mentor for those around you?
So, diversity is a very important issue. And there are many aspects of medicine, but there are other aspects. So I usually like to think about it in three different ways. The first is the patient population we serve. You got to think about that diversity of the population that we serve is absolutely very, very important. It's important for us to provide good health care to the sickest and the most impoverished in our society. And when we think in those terms, then diversity will come naturally to you, because there are segments of our society that are unable to access that healthcare. They're the ones who are most impacted. So I think the same compassion and care that we give to the most prominent and powerful and wealthy in our society should also be given to those that are impoverished. So I think that's the first aspect of diversity. The second thing is, I think we need to think that patient care has got to be number one. That means we've got to build trust amongst that patient population. The reason they don't access the healthcare system is because oftentimes they don't trust us. They don't think we have their best at heart. And sometimes they have good reasons to believe so. So we have to be able to garner their trust. It takes a while for us to build trust with them, but sometimes the trust will come if they see members of their own community represented amongst ourselves. So the healthcare workforce also needs to be diverse to provide care to a diverse population. So that's number two. And we have to make that effort to make that happen, people that we recruit and mentor and bring along. And the third thing is research. And there, if you have a diverse research portfolio with people, researchers that come from various aspects of society, they will bring very innovative thoughts and they will question things in a way that you may not otherwise think about. So that brings innovation through diversity. So I think if you think of it in those terms, then I think we can really make a huge difference to the population that we care and make major advancements in science and research.
Yeah, I think you're spot on. And those three components are comprehensive. And I think you're covering all those different aspects is developing that trust, as you said, making sure that that diversity is leading to sort of equitable and a fair division of care, and then making sure that we're pushing our knowledge and our science forward to take care of everybody and not just those who have access or who are better represented. This podcast is too short to talk about all of the projects and all of the contributions over the career. And so I'm going to try and pin you down on a couple of these questions and give you a chance to tell us maybe about one project or one undertaking that, as you reflect, has been the most rewarding for you thus far in your career.
Okay, what is really challenging my mind at the moment, and I think what it is in broad terms, it is the post-infection syndromes. And I say that because with the current pandemic, it's long COVID. Prior to that, it was the chronic fatigue syndrome, and there's significant overlap. And I think that's another segment of society that has not been taken seriously. So oftentimes they come to the physician and they get all the testing done and nobody finds anything wrong with them, and they are labeled as being psychological, but really they have a biological basis. So we've spent a huge amount of effort trying to understand these diseases, understanding the overlap between them. And we just recently published a paper showing that there are very specific immune abnormalities that drive these two syndromes. There's a possibility that there is a residual antigen that is still present from the past infection that precipitated the event. And there are similar syndromes. You have post-Lyme disease, you have Gulf War syndrome, sick building syndrome. They all, I think, are one and the same. They just have different names. But I think if you can solve one, you can solve them all. And that, I think, is what I am very passionate about at the moment, because I think it's a huge segment of society that's been impacted by it. And I think we really need to do something to fix this.
There's a lot of people who are listening who can think of examples of patients that they have encountered with, as you said, these different syndromes that probably have a common thread, and post-infectious, be it post-COVID or a post-Lyme or a chronic fatigue, and the struggles that we as physicians may have of trying to figure out explanation behind the symptoms that these patients are having, and how that begets a difficulty for us to help them with their symptoms. And if we can offer some knowledge and some explanation of what's going on, obviously, can we both change how we think about these patients, but also change how we think about treating them?
Yeah, that's so true.
I'm going to flip that question around and ask, do you have any career regrets, or is there something you'd go back and alter or change if you could?
Yeah, I wish you had a magic wand, right? Okay, well, if there's something I'd like to change, I think it's the system that we currently have. I think that really we need to think about them in broad terms and see what we need to do. What I'm most frustrated about is the progress in science takes too long and is very slow. So again and again, we are reminded that neurological diseases have the greatest burden in society, yet we have very few interventions. It's not like we haven't made progress in neurology, we substantially have, but yet it's not enough. Lots of diseases, brain tumors, ALS, a whole host of diseases where we've made small progress, but doesn't really do much for the vast majority of our patients. And it could take us centuries before we develop treatments if we go along the lines that we're doing currently. The way we do research, the way we do drug approvals, you need non-human primate studies, this, that, and the other. Just for each disease, separately, it will take you many centuries before you find something. Our lifespan is short. We like to be able to do something. And so we need to think the whole process very differently as to starting from how we even train physicians and neurologists. Even the training process is too long. If you want to be an MD, PhD and get your R01, you're talking about your mid-40s. Other professions, people are thinking about winding up their careers. We're just starting out. And we're losing the most brilliant minds. They don't want to get into this profession because they see, the other classmates from high school or whatever, they're already doing so well. And here you're still struggling, on calls for 18 hours a day, week after week. So I think we need to think about the entire process as to how we train people, how we do clinical trials, how we do drug approvals, how we even develop drugs. And so unless we do that, I think we're not going to make any substantial difference. So that is what I would like to change if I could. Think about it. You get a new drug approved right now for gene therapy or whatever. It could cost you $100,000 for a single dose, right?
Right.
How many people in this world can afford it? And we want to provide global care for neurology. It's just not sustainable.
Right. It's a mismatch, right? We can't. It's not sustainable. Exactly right. Exactly right. Avi, to finish us up, I want to circle back to the spirit and the focus of this award, which is humanism in neurology, and have you put on the hat of an advisor or a teacher and imagine you're talking to a trainee or a mentee or someone who maybe even a peer who's further along in their career. And what advice would you have to help us make sure that we as neurologists can continue to maintain humanism in our careers?
So we all enter medicine due to some early childhood experience that drives our passion to treat the sick, right? And to develop new treatments. But somewhere along that line, the realities of life intervene, right? And that passion gets lost. So my one and only advice would be to never lose that passion. And when times are tough, we need to sit back and think as to why we entered this profession and let those feelings reemerge and let those drive our decision. And I think that will provide us the greatest satisfaction in life, and it will make a lasting difference, he says. And so that, I think, what humanism is all about.
And we can lose sight of those passions and that spark so quickly, with all the different things going on around us. And to have an ability to reach back and think about what's driving us, what drove us originally, and circle back to that. I think that's fantastic advice for everyone to keep in mind. Avi, thank you. Once again, I've been speaking with Avindra Nath of the NINDS and NIH, the winner of the American Brain Foundation's 2024 Ted Burns Humanism in Neurology Award. Avi, thank you for joining us.
Well, thanks so much for having me. Yes, this was a real honor and a real pleasure.
This is Stacey Clardy, your podcast editor. If you've enjoyed the podcast, please take a few moments to subscribe, rate, and review the Neurology Podcast through Apple Podcasts, Google Podcasts, Spotify, or wherever you listen. And remember, you can always head to neurology.org/podcast for our full list of past episodes, or you can also search by keyword in your podcast app for any neurology-specific topics you want to learn about.